Watching this video, it's because you put in the search terms SMA, which is superior mesenteric artery, of course. That's why you put that in there. Anyway, so back in November of 2014, I had this left abdominal pain, and after a couple of days it didn't go away, so I went to go see the doc, and they did a CT scan and found out that I had a intima dissection of the superior mesenteric artery. And so after doing a lot of research, it resolved itself in November of 2014, and I saw the doc. He made the diagnosis and didn't do much about it. Well, 6 months later, he called me up and he says, hey, he says, I want to follow up to see what's going on inside there. And so they did a CT scan and a arteriogram, and I found out that the dissection actually had progressed, and the artery had become aneurysmal, well, an aneurysm. So he recommended I go to Houston, see this world-famous doctor, for them to cut me open and do a bypass of that artery because it was, an aneurysm. Well, intuition told me maybe that's not what I wanted to do. So my sis, who's been a nurse for 35 years, got to talking to me. She says, look, she says, that may be old school thinking. To cut somebody open and do a bypass, she says, stenting is a fairly new way to approach these aneurysms, and check it out. So my son, who's in Houston, did some research, found a doctor by the name of Miguel Gomez out of Katy. Actually, it's in Houston, but it's a Katy address. And he had recommended to do a stent. But he was very worried about it because he had to go up through the femoral artery, make a 90-degree turn into the origin of the SMA, and then do some more gyrations to actually get the stent delivered into the appropriate space. There's also concern that in that process, they could have compromised and breached the aortic artery, and or breached the or broke the penetrated the wall to the SMA. So it's kind of dicey. Anyway, I decided to go that route, even against the advice of the heart doctor that wanted to do the open surgical repair. Anyway, Dr. Gomez did great. Everything worked out fine. The stent that was placed is actually 2.5 centimeters long, which was about a little more than an inch long. He placed it in the right place, did not block off any of the branch arteries from the SMA, which of course did not then starve the receiving organs of the blood supply. And so if you want to go a different route, and I did a lot of research trying to find a doctor that would actually do this kind of procedure. It is, as you now probably recognize or have researched, a highly rare condition. In fact, there's only been 72 reported, and this is July of 2015. The only other two doctors that I saw that actually did this kind of procedure was one in Japan and one in Saudi Arabia. So look up Miguel Gomez, Houston/Katy, Texas. And if you've got this problem, and he can help you out. I wish I had seen this video back in April when I was told that I had this problem. Well, good luck to you. Thanks for listening.